Inspiration and expiration. Why does timing matter in a clinical setting? The IE ratio is a vital sign that nurses often overlook during rapid patient assessment. If these phases are imbalanced, your patient can quickly suffer from respiratory fatigue or distress. Let's explore why the mechanics of the breathing cycle are so critical. The IE ratio specifically compares the duration of inspiration to the duration of expiration. In a normal resting adult, expiration is naturally longer than inspiration, typically following a 1-to-2 ratio. This rhythm ensures that the lungs have enough time to empty passively and efficiently during every breath. Clinical insight is crucial. COPD patients need an even longer expiration phase to prevent dangerous air trapping. By managing the IE ratio on a ventilator, we control the breathing rhythm and optimize gas exchange for those with obstructive issues. Mastering this timing is a key skill for effective nursing interventions.